I've never seen a smaller surgical kit. There isn't a smaller surgical kit. Using 3 drills to put an implant in is phenomenal. Okay, it has taken a couple of minutes out of my implant placement, it's no big deal. But realistically speaking, for the new practitioners who are getting into implant dentistry, to have that ability to place just or use just 3 drills to put a standard size fixture goes a long way in giving them the confidence that perhaps in straightforward cases in practice, they can do it. Once that is done, the prosthetic rehabilitation is probably the most straightforward one I've ever seen, because the platform is universal. I mean, it's the same platform for whichever size implant you want to use. So it makes a big difference when you are communicating with your referring dentist. So as a referral practitioner, going forward, as my juniors then take over my role as specialists, it'd be so much easier for them to convince their referring dentist to say, let's try this system, because it's one size fits all. It has been pretty much the known fact that the tissue response in bone level implants tend to be different from tissue response in tissue level implants. That is where I think Neodent is slightly different, because I've taken out the healing abutments now consistently for probably over 100 implants, and the tissue response is pink. Although it's a bone level implant placed 2 mm subcrestal, the tissue response is second to none. I've not seen a better response, whether it be tissue level or bone level implant. So it's pink, it's healthy, and you want to start restoring straight away. I have a feeling, I think the fit of the healing abutment to the implant has a role to play as well. It causes minor Mohs taper that really is a good, excellent seal, and therefore doesn't let any bacterial ingress, and the tissue response is excellent. What makes me take on a system like this, along with all these advantages, is the team that looks after us. I think when you're working with an implant system, you're not just working with that implant system, you're working with the entire package, the industry, the history behind the implant, how much literature do we have, what is the support that we get, and all those things come into the forefront. And if you don't have that support, you can't take on an implant system, because I think even at our level of dentistry, we need help. And if that help or the guidance, or any kind of mentorship is not there at a higher level and a higher level, then it's very hard to pursue an implant system. I think I've placed 5,500 dental implants. I'm still learning.